This summer has been like no other, and I'm not just talking about the recent gloomy weather. Clearly, our hospitals haven't had the respite that we'd all hoped for, and the number of emergency admissions and pressures across all departments has remained very high. This week I visited our two fantastic emergency departments. Teams on both sites have seen a huge surge in the number of patients coming in, with overall attendances up by 3%, and those brought in by ambulances up by a staggering 9% compared to 2019. At the same time, some of the workforce shortages have resulted in ongoing pressures for staff, and there's been an enormous knock-on effect on all our departments. I know things are enormously busy, but as always, I was really encouraged by the professionalism and resilience of our staff as you find ways of rising to these challenges and continue to support each other. It's great to see the practical improvements that have been made in recent months, in particular the refurbishment in the pool emergency department that's now so much better designed to allow smooth patient flow. Every little helps, and it's encouraging to see the plans that have been developed by staff themselves being put into action, and in that way we are making things better. We've invested additional resources into these departments, and each month more staff are choosing to join UHD. So despite how it feels now, there's definitely hope for the future. I was so pleased to be able to meet with staff on both sites to thank them again for all that they're doing in these difficult times and to hear about the ways in which they're tackling their problems. It's always humbling to meet with our frontline teams, and I couldn't be prouder of our UHD staff. I know that with everything so busy, some staff have found it hard to take breaks, and some people haven't wanted to take their annual leave knowing that this can create pressures for their colleagues. I know myself just how that feels, but can I encourage you not to do this? Each and every one of you must get a break. This is so important for you, your family, your patients, and of course your colleagues. We all need to rest and recuperate, then come back in refreshed to give of our best. And remember, no matter how busy you are, do take time to access the support that is available. It's all detailed in the Wellbeing section on our intranet. Meanwhile, myself and my executive colleagues have been working with partners across Dorset to tackle the underlying problems that are resulting in all this demand. We're doing all that we can to support our partners as they work to keep patients in the community and to avoid admission altogether. Very importantly, we're working to support partners as they develop more capacity outside the hospital so that we can discharge patients who don't need emergency or acute care more swiftly. There are lots of exciting development plans for the autumn, and our focus now is on trying to bring these to fruition as quickly as possible to alleviate the pressures on our teams and improve the overall standard of care that we can provide for our patients. And I know that this is really important to each and every one of you. In looking ahead to the autumn, I'm keen to get on top of our elective work, and I'm so excited by our Think Big project. This month we've confirmed that UHD will soon be running a new innovative outpatient service from the top floor of Beals in the Dolphin Centre in Poole. This is going to make a real difference in reducing waiting times as we use space, technology and people in very new and different ways to enable us to see large numbers of patients. The centre will initially be providing dermatology, orthopaedics, ophthalmology and breast screening services. By setting up services in the middle of Poole, which are so easily accessible by bus, car and train, women from across the whole of Dorset will have the opportunity to access those really important mammograms that have been delayed by COVID. And all of this will be within a purpose-built unit designed around the flow of patients to avoid waiting and allow for swift results. Patients are going to be using this facility from later on this year, so we'll update you on progress as we go. In the meantime, COVID hasn't gone away, which means that this year we can't throw open our doors to the public for our annual open day. Nevertheless, we know how much the public enjoys seeing what's going on behind the scenes, so for 2021 we're going to provide a virtual open day to coincide with our annual members meeting on Saturday the 11th of September. Thanks so much to everyone who's involved with the planning for this, and I'm really looking forward to this online event, which will be running from 10 in the morning till 4:30 in the afternoon. There's a great range of activities, from tours of our theatres and our maternity unit to talks on health topics such as asthma. There really is something for everyone, so I'd like to encourage your friends and families to log on. Full details will be available on our website. So I know that things still feel very pressurised, but I want you to know that your contribution really is enormously appreciated. Every single one of you is making a massive difference to the experience and outcomes for our patients. Our culture champions have been out and about seeking your views as to what makes you feel valued and how you'd like UHD to thank you for your hard work. Your opinions will help shape the way that we do things going forwards, so please do take part in the survey, which closes at the end of this month. This is a great opportunity for us to listen to each other, to create something new that will benefit all our staff. Early feedback from the survey has reaffirmed that just saying thank you makes an enormous difference. It may be simple, but we know that the impact is huge. So, thank you to all my amazing UHD colleagues. I really wouldn't want to work anywhere else. Thanks so much.